Hi, Ralph. Are we almost ready to get started?
Yes, I would say we can begin. We have about 39 on.
We'll start slowly.
So welcome to our Memorial Health Fund Information Session webinar. I'm so glad you could join us today. I'm Roth Prep, Grants Program Associate, and I'm joined by Lisa Levin, VP of the Community Investment Team here at YCCF. Thank you so much for joining us today and for the amazing work you do to improve the lives of the people you serve. And thank you for giving us the chance to partner with you in your work. Our goal today is for you to leave this webinar with a good understanding of our application process and to be confident in your ability to apply to us for funding. I encourage you to stay till the end so we can answer any questions you may have. A little bit of housekeeping. Please hold the majority of questions until the end. You can type questions throughout the duration of the webinar using this box here. You do have the option to submit them anonymously if you'd like. The agenda for today is to go over the Memorial Health Fund and to give a brief overview of the Memorial Health Fund. We're going to step through the application and provide some resources to help you apply. A little bit of quick tips and what happens after you apply, and ultimately, hopefully, get funded. Again, you can type questions in throughout the duration of the webinar, but please hold until the end. We'll answer the majority of questions then. Before we move on, I'd like to hand the mic over to Lisa.
Thank you, Roth. Roth is the person you'll contact with any questions you have about using our online grant system. The Memorial Health Fund was created with the proceeds from the sale of Memorial Hospital in 2012. Through its grant-making program, Memorial Health Fund is continuing its legacy of care for York by improving the complete physical, mental, and social well-being of the residents of York now and forever. For 2020, it has increased the amount it will award for competitive grants and will consider applications from health organizations working in new ways as a result of COVID-19. While it is affiliated with YCCF, Memorial has its own board of directors and makes its grant decisions independent of the Community Foundation. Next, as you can see, the focus area for grants is pretty broad. We're just going to hold here a moment and you can do your own reading. Memorial is especially interested in grants that demonstrate impact and collaboration, particularly when organizations are working on similar programs and are able to do the hard work of aligning their programs to amplify the impact on the community being served. They're also looking for programs that can be sustained once its award period is over. And this is also true for programs that are for new ways of working due to COVID-19. Memorial is still looking for programs that are strategic and high impact. Here's the timeline for the grant cycle. We've accelerated it this year in order to get money out into the community sooner. Please be aware, though, that the larger the grant requested, the bigger impact it must be capable of achieving. After you submit your application, staff will read it and respond to you with any questions or clarifications that we think will help grant readers better understand your program. You'll have until August 3rd to respond, when your application will move on to our grant readers. Our webinar today is about our competitive grant cycle, with a total of $400,000 available to grant, up from $300,000 it's made available in past years. In addition to competitive grants, Memorial also has partnered with organizations and groups working to make change at the systems level with large grants, including grants to reduce disparities in the rate of low birth weight babies across the county, and to close the meal gap in the charitable food system. If you, or even better, you together with other organizations, are considering making changes in the systems level, perhaps arising out of COVID-19, we would be very happy to meet with you to learn more. Grantee eligibility is limited mostly to 501c3s that provide services directly within York County. So let's talk about the grant application itself. And we're going to step through the entire application here, although quickly. You may have a standard mission statement that you use, and that's fine. What we're looking for more specifically here is how your mission relates to this grant. So if that's not immediately apparent, this is your chance to make that connection for us. You can just upload an existing document here with your board of directors if you already have one. Just be sure it helps us understand who your directors are by including their affiliations. The title and brief description set the stage for the application. These two fields will be pulled for all our reporting that talks about our grant slate. This is the time to start looking at how all of your answers align as you explain your program. You want to be sure that everything ties together, from your program title to your attachments at the end of the application. At the same time, you want to focus on the specific information requested in each field so that you don't repeat the same information in multiple fields. Program type is whether this is a new program or whether you are expanding an existing program or whether this is an early stage grant for planning or other purposes. Pay attention to details. Be sure your program start date isn't before funding decisions will be announced in September. This date should be when you anticipate you will actually need the funding. And remember, it can't be before September, so you can't apply for program purchases that were made prior to that date. The amount requested is what you are requesting from the Memorial Health Fund, not the entire program. And you should be sure that the amount requested matches what you put in the budget section of the application, the narrative section, as well as the budget itself. Remember, many grant programs may not know your program or how it's different from others with which they may already be familiar. So this is your chance to position how your program is different from what already exists. The question about who's leading this program is your chance to tell us about the great qualifications of the people you have running your program, what their experience is that relates to this work, how long they've been doing it, and other details that help us understand why this program can help the program succeed. This person can help the program succeed. Telling us why this program should be funded is another opportunity to talk about how great your program is. What is powerful here is if you don't repeat something you've already said, but rather dig deep and tell us the unique reason why this program is so important. After that, you'll tell us how you'll know what your program will achieve. Everyone who applies needs to select at least one indicator, method of measurement, and degree of change when applying for funding. These terms are defined right on the application. So for example, for an indicator, it's the observable, measurable change your program will make. So for example, people in the program will lower their cholesterol. Method of measurement, how this change will be measured, and tools that will be used to measure this change. We know your program makes a difference or you wouldn't be running it. But how will you know? You need to document the change your program is making. Try to stay away from pre and post testing or self-reporting, especially if you were requesting a large amount of funding. The degree of change is the percentage or numerical evidence of change that your program will make. Be realistic. Don't overpromise how many people you believe will be served by your program or how many people will have their lives changed. Realistic expectations of numbers served and degree of change demonstrate that you have a true understanding of the challenges and opportunities faced by your program. And all of these are only for the program for which you are requesting funding, not for your entire organization. Together with the next fields, number served and how you arrived at that number, all this will be put into your post-grant report, and you'll have an opportunity to explain what you actually achieved compared with what your program design anticipated. This helps us learn with you about what worked well and less well and why. The next question is critical and one you should consider before you even begin writing this grant. How will this program be sustained after the grant ends? Sometimes people say here that they will fundraise more for it in the future, or they will budget for it in the future. And that makes grant readers wonder why you don't just do those things now. You may or may not expect to expand this program. Maybe it's a pilot to prove a proof of concept, or maybe it's something that could be eligible for public funding once you demonstrate your capacity to run it and the great impact that it has. Your total program budget is the complete cost of the program for which you're applying for funding. It's not your organization's total budget or only what you're requesting from us. Instead, it's the full budget of the program you've been describing. If you have funding committed from other places, public or private, we ask that you also show it here. If you have an existing budget for this program, you can simply upload it, or you can use the template that we provide. Be sure to show what in the budget you are requesting from Memorial Health Fund, and make sure this matches what you filled in when you first started this application. Also, show what you may already have had committed from other sources, or that you've requested, or that you intend to request. If there's revenue, be sure to show it here. Next are the supporting documents that are required for your grant to be considered for funding. Please contact me with any questions you have about these. These next fields allow you to beef up grant readers' understanding of who you are and the commitment of any partners with whom you may be working. Letters of support are from organizations or people who are willing to speak to their support of this program. They may or may not be working on it, but they are in a position to vouch for the idea or for you or for the quality of the work that you've done. It's not necessary for you to have letters of support. For federal grants, letters of support may be cut and paste with exactly the same information on different letterheads. We urge you to think twice before submitting these to us, because our grant readers actually read these letters and it may undermine the sincerity of what your letter writers are saying. We strongly recommend that you do include letters of collaboration from partners with whom you're actually working on the project. So for example, if your program is going to be conducted in a nearby school, you should definitely have a letter from the school saying that it's partnering with you on that program, and specifically what their commitment is. Is it just to let you use the building, or are they actually participating in the program? Additional file loads are your chance to include anything else you think is crucial for people to see. Drawings of a new activity room, or a logic model for your program, or an executive summary of research on which your program model is based, or anything else that you think helps your case for support. And that's it for the application itself. All grant applications must be filled out online using our grant system, and we have resources also online to help you with this. Remember, if you've never applied to us before, you'll want to watch the tutorial video from the beginning to the end. These and other resources are available on our website. Click on Grant Seekers and then Applicant Resources, and you'll find all kinds of materials to help you with this process. You're also welcome to call me with any questions that you may have. This webinar and the accompanying slide deck will be posted on this link shortly. Here's some quick tips about applying. Since almost all communication about your grant will be through Foundant, our online system, Be sure when applying online to test the email system. We've had applicants who skipped this and then didn't understand why they weren't hearing from us because our communications went to their spam folder. This list of documents, we know from experience, sometimes takes longer to gather. And so we suggest you start pulling these together as soon as possible so that you don't miss the grant deadline. Finally, we recommend having someone not close to your program read your application. Their feedback could help you strengthen your application before you submit it. Remember, it's possible that our grant readers will not be at all familiar with your organization or with your program. So the only thing they'll know is what you have in your narrative. Once your application is submitted for the last time on August 3rd, a vetting process begins. Memorial ensures that your organization is eligible before an application is read and scored. And here's the rubric that will be used to score your application. This is also available online. You can use this as a self-evaluation process to have someone else read your grant and score it. And that way you can be certain that your narrative is as effective as possible in making your case for support. Congratulations, you were funded. Now the work begins. We know that changes will happen. Remember though, that you need to contact us about any changes to your budget, to your timeline, to the scope of your program. We are happy to work with you through that process. We want to learn with you so we can become better partners with our grant applicants. Any report requests will be pushed out for our online system. We may request an interim grant report so we can learn about how the program is progressing, or feel free to shoot us an email and just keep us in the loop. We will definitely request a post-grant report. Both reports include a single reflection field. Staff may request to meet or speak with you after the post-grant report is submitted so we can talk in more detail about what your experience was with the program. We encourage you to talk with us about your grant idea before submitting your application to us. We'd be happy to hear from anyone who was interested in applying. And that's it for today. If you have any questions about anything you've heard, I'm happy to take questions now.
Lisa, we did have one question in. It reads, must the request only be program related? Can it be for retrofitting an organization to address health precautions related to COVID-19?
You know, we're getting questions about that. And my answer would be that, back to the beginning of this webinar, Memorial is looking for strategic, innovative program ideas. I think that if it were simply for cleaning supplies, PPEs, plastic shields, that might be too operational, unless that were also paired to a new program idea or an expanded program idea. I think that I would fear that all of the grant funding would go for operational purposes, and we won't move the community forward with new ways of working.
Any other questions? Please type them in. Got another one. At the beginning, it was mentioned that the fund was for York, PA. However, later it mentioned that applicants should be doing business in York County. Are areas outside York City eligible?
Absolutely. This is a York County fund. When I said York, I meant the county and the city. An organization might even be based elsewhere, but they can only apply for funding for that part of their service that is in York County.
Another great question. If the grant is intended due to COVID-19, how do we offer the program end date? I think I read that right. So yeah, how do we offer or how do they submit or type in their program end date?
I think I really appreciate that question. You know, I think we all know that there's going to be a new normal and then maybe a new normal after that. And we really struggled with how to conduct this grant cycle. So you notice that we are accepting grants until July 10th. My hope is that things might be a little bit clearer then. But we did want the opportunity to get money out to nonprofits that are doing great work in the community. So we decided to hold it anyway. I think you'll have to make your program request with the best information you have as of July 10th, knowing that we've shortened the back end of the process so that you will be receiving money if funded in early September. Mindy, if you have more specific questions relative to the time frame or anybody else on this webinar, please feel free to reach out to me and we can discuss.
Okay. Can you talk more about the larger grant pool of funds? Are they part of the grant process or is this only for the competitive grant pool?
This is only for the competitive grant pool. The Memorial Board is continuing granting to its food work that it funded starting back a few years ago. It is also considering funding related to reducing isolation and depression in older adults. It hasn't moved forward with that. But I would say again, if you are working in on a systems approach, by which we mean something that helps the entire population in the county or potentially just in the city, and you have an idea of a systems approach to a deep-rooted problem, please reach out to me and I would be very happy to talk about that with you.
Okay. Will the board be giving priority to COVID-19 related grants?
Not necessarily. This is a grant-making board and the board itself makes up the grant readers. And so what they're really looking for is things that move the needle. Perhaps it is COVID-19 related, but perhaps it is not. And they felt very strongly in discussing the timing of this grant round that they didn't want to stop great innovative work that wasn't related to COVID-19. So they're really looking for both.
What is the minimum and maximum amount for a grant request?
Great question. There is no minimum. And I am especially grateful to those of you who have applied in the past for $2,000 or $3,000 or $4,000 grant. If it is a high impact grant, the upper level is up to $50,000 for a grant.
That's all the questions I have for right now. Is there any other questions?
I'd just like to take a moment to thank all of you on this call today. I know your work is difficult and challenging under the best of circumstances, and I know that you're doing amazing work in light of COVID-19. This is a time that makes me really proud to be a grant maker in York County. This really is such a caring, strong nonprofit community, and each and every one of you makes up an important part of that. Roth, I think there might be another question.
Yep. Does the grant need to be for all ages or can it be for older adults?
It can be for any age.
Okay. And that's all.
Thank you, everybody. We so appreciate you being on this call. You know how to reach us. If you want to watch this webinar or read this PowerPoint deck again, it will all be online, I'm guessing at least by Thursday.